Hi everyone, I'm Steve Miranda, and I want to welcome you to another edition of our Oracle Health Inside Access. This is our monthly webcast where we discuss and demonstrate our commitment to the changing global landscape through innovation. Now, we encourage your participation through this session, sharing ideas, so please submit your questions and feedback through the Zoom Q&A function. And so that we can continue our partnership and give feedback, and we will have people behind the scenes throughout the presentation answering your questions as they come in. With that, let's get started. So for today's webcast, we're going to focus specifically on the integration between Oracle Health Clinical Application and our business solutions. More specifically, between the real-time health system and our Fusion SaaS applications. We will cover those through a number of examples and through demonstrations of the actual systems that we have delivered to you, our customers, so you can see the products and the innovation in action. Now, before we get into the product, let's just take a step back and talk about what you all deal with every day, the biggest challenges that we're facing across the healthcare. Starting with, of course, workforce shortages, difficulty in terms of recruiting, difficulty in terms of training, difficulty in terms of retaining staff because of all the pressures that we've been under for a number of years. Of course, then there's financial pressures, the rising labor costs, costs of supplies, costs of pharmaceuticals, and other financial pressures, both pre and now post-pandemic, have really put a strong burden on how we deliver best care at the lowest, most economical price with financial pressures. And finally, of course, the focus on patient care. Really, our objective is to deliver the best data-driven patient care to all the people. Those align very closely to the priorities that we have here at Oracle. What are we building and what are we trying to deliver in terms of innovation? First, we focus on better patient care, focusing on data-driven treatment, innovation across that data, more and more preventative care, and allowing caregivers to spend quality time with patients. That ties very closely into our second focus area, which is enhancing employee experience. So really having it so that the caregivers focus on the patients and their main role, and not having to focus on administrative burden. We do that by delivering better tools, more automation, more accurately and more completely, so that doctors, physicians, caregivers, nurses don't have to spend time on the back office and really spend as much time on the front lines with their patients. And finally, we deliver it through focus on operational excellence, automating processes that are in the back office, streamlining manual tasks, focus on efficiency around the supply chain and procurement so that it allows hospitals and institutions to deliver that care at the lowest overall cost. And how do we do all this? Really at the center is our data platform. We believe fundamentally that by connecting the data in the systems, we can then deliver a better overall solution by adding the applications and artificial intelligence, having end-to-end automation, end-to-end data, so there's no longer silos of information, disconnects on data, human beings having to re-enter data, and importantly, mistakes, which all leads to lower quality of care and higher cost. At Oracle, we do this by delivering a complete suite of applications, starting, of course, with our clinical applications, healthcare records, patient engagements, operations, things that are really on the front line. But importantly, focus then on connecting those things to the systems that need to help the hospitals operate. So connecting those clinical applications to our Fusion applications, ERP, financials, budgeting, planning, supply chain products, including inventory and procurement, human capital management, including time cards, learning capabilities, and payroll capabilities. And then finally, umbrella of top of all that, a data intelligence platform that allows you to drive insights, get real-time reporting on what's important to your organization and what's really going to help improve the care for patients. And this is the part where I need to thank all of you, our customers. Every one of the innovations we deliver, all of the features I've talked about, and all that we're going to demonstrate, we do in close partnership with our healthcare customers. And as you can see, it's really a who's who of the top medical organizations around the world, helping us design, implement, and then improve these features for better outcomes at a lower cost. So a big thank you to you, our customers. And with that, I mentioned before, you're actually going to see product during this session. And we're going to focus really on 3 specific areas where we put the bulk of the innovation. And this is innovation enhancing our Fusion SaaS operational applications and enhancing those in a way to make them specific for healthcare, but also make them connect to our clinical systems. You'll see examples in HCM. In HCM, we put huge investment around workforce scheduling, with a particular focus on nursing scheduling. Also, with the idea that we want to eliminate the need that caregivers need to be checking up on their time cards, correcting their payroll, but really taking that integration of what's happening in the clinical systems, feeding the back office systems, and driving accuracy and efficiency through automation. Second, tight integration with supply chain management and the hospital systems, and adding specific features in supply chain around replenishment planning, mobile part management, and inventory management through digital and mobile, so that the hospitals, again, could efficiently track supply chain and optimize purchases for lower costs of operations. And finally, in our ERP, adding capabilities around financials, planning, inventory, and budgeting, so that ties into the clinical system to give you the most comprehensive end-to-end solution for healthcare. So with that, enough talking about features. Now I'd love to show you features. So let me introduce Chris Leone. Chris is our Executive Vice President of Application Development, who'll be demonstrating a lot of these examples. Chris?
Thank you, Steve. I'm excited to show you some of the examples that we have showing the seamless integration between Oracle Health and Fusion applications. And I'm going to start with our supply chain operations application. And one of the processes that I'm going to start with is around inventory management. It's really critical to make sure that you keep your inventory levels at the right replenishment levels throughout all your hospitals in order for you to fulfill the needs of your patients and any of the surgeries that you have going on. So I'm going to walk you through a standard business process called periodic automatic replenishment, or PAR, where we have locations, inventory locations throughout the hospital. And we want to make sure that they have the minimum level of inventory to make sure that they can fulfill all the needs. So let me start on my mobile device. So everything that I'm going to be showing you on the supply chain operations side is all 100% mobile enabled. So I'm going to start with a PAR count, and I'm going to go to Seattle General. That's where I'm working. So we'll start with Seattle General. And I'm going to use the barcode technology that we've built into this solution. We leverage GS1, which is a standard for healthcare. And I'm going to just scan it with my phone. It's going to scan the location as I'm coming in. And I'm at Cath Lab Room. And this is the set of inventory items that I need to count or recount. So I'm going to start this process. And again, I'm going to scan the location. So this is a bin that I'm scanning here. So it's on rack 1, shelf 2, bin 12. And now I'm going to scan the actual item. And it's gloves. I need to do a physical count of the gloves on hand. We have 3 boxes that are on hand. And I'm going to count that and go to the next item. So what's nice here is there's a minimum level that we need to replenish. I counted the items and they'll get replenished back to where they need to be. Instead of scanning the next one, I'm just going to select bin 5, and very easily I'm going to select tubing because it's right here, and I'm going to give a physical count. There are 4 available, and I can continue this physical count in order for me to finish everything in this one inventory location so we can replenish it up to the right level. But I'm going to cancel here, and you can see I've counted tubing and gloves, and I could just finish this process very, very easily. But I'm going to stop here. I have other assignments that I need to fulfill during today. So I'm going to go and cancel out, and I'm going to come back. And the second part of my job for the day is to deliver goods in a particular hospital. So we use our barcoding mobile inventory solution to receive items at the shipping dock. They come to a central location, and then we put them on carts and deliver them to office staff or to patients throughout our hospitals. So pretty standard process. I'm going to show you how it's automated and all delivered on a mobile device. So first I'm going to go to deliver goods. And again, I'm going to select the organization. I'm still at Seattle General. But the cart that I'm working is cart 1. That's going to be my responsibility for today. And I have 2 deliveries to make. First delivery is in Building A, second floor, room 2443. And this is going to Michael Wheeler. Michael's getting a brand new MacBook. Congratulations. And I'm going to scan the item to make sure I'm delivering the right item. There it is, a MacBook. And then I'm going to ask Michael to sign. And just with his finger, he signs here, and I've completed that delivery. I have one more delivery to make, super simple. Just need to go back to my cart. And now I'm going to Building 3, 3rd floor, room 3763. But this is for a patient. So Christine Blackwell had surgery yesterday. She's in recovery today. And a family member sent her some flowers. So I'm going to scan this, have the right item, but Christine's not in the room. So I am going to take a picture of where I left the item and leave a quick note. Just like a UPS driver coming to your door takes a picture of the package that they dropped off, I'm going to do the same. Very, very easily, I enable my camera, take a picture of the item, shows up, and I'm going to let Christine know left item on bed. And I'm going to go ahead and complete that delivery. So now I've completed 2 of my assignments for today. Did part count, delivered goods to patients, and now I need to place a special order, and I'm going to use our guided buying process as part of our procurement application to help manage costs of supplies for all of our hospitals. And I'm going to go into our procurement application, and this is a guided buying process. So the first screen that I come to is where I search for the item I'm looking for. Now, I'm searching for a specialty item. And that specialty item is for a doctor who only likes to work with certain types of bandages. And so I'm going to search for silver wound dressing. And the first search results are all of the high volume contracted items that I really want to drive everyone to purchase from. These are where I get volume discounts, and these are the best price for these types of wound dressing. But I have a very picky doctor that really only likes to work with a specialty type, and I don't see it in my preferred contract items. So we can guide the experience to our extended contracts. So I'm going to go into extended contracts, and I'm going to look for that item. And again, I don't see the specific item that I'm looking for in our extended contracts. So now I'm going to go to a solution that we're delivering called Oracle Healthcare Marketplace. So this extends the buying experience into a partner solution where there are millions of items available to be searched against. So extremely robust catalog with all of the details that I need in order to make sure I get the right item. So I'm going to try the Oracle Healthcare Marketplace. Seamless experience, and I can see great. The silver negative pressure wound dressing, my second item is exactly what I'm looking for. So I'm going to select that item. And what's great about this is I have a full description. So when I send this to our buyer, they have the description, and more importantly, they have the manufacturer ID, so we can make sure we're getting the exact right item. So I'm going to go ahead and add this to my cart, and I'm going to view my cart. So this is where you see I have 2 items in my cart that have a price next to them, but this silver negative pressure wound dressing, doesn't have a price, but I have all the information I need. So when I submit this order, our buyer will be able to go find it and negotiate the best price possible and have all of the information that they need in order to make sure it's the right item. So here what I've done is delivered a guided buying experience, starting with our preferred contracts, going to extended contracts, and then to an open marketplace where I can find items that are specific to what I need and then send them to a buyer to negotiate pricing. And those were just a few examples of how our supply chain applications can help lower costs for healthcare customers. Now let's switch over to some of the areas of investment that we're making around helping on the staffing side for our healthcare customers. And we're going to do that from the desktop. So let me start with our newly delivered scheduling application. And let me just go ahead and go into our workforce scheduling application. And we have two modes that we can schedule our staff with. The first one is self-scheduling. So we can allow our entire staff to come in and self-schedule. We have a set of rules that fire behind to make sure that they have the right certifications for the schedules that they're signing up for. Or we can try to optimize labor deployment and generate schedules. And that's what I've done here today. I've generated those schedules. Now, when we talk about the seamless integration between Oracle Health and our Fusion applications, this is one of the examples where we're bringing over all of the demand information, or a good portion of the demand information from Oracle Health, directly to help us drive an optimized labor deployment generated schedule. What I'm going to show you here is after that schedule's been generated, I'm going to go through and I'm going to level that schedule. So I'm looking at a 6-week period here that's in progress, and I'm going to drill in and I'm going to see some of the details of that schedule. So I'm looking at it from a worker view, as you can see right here. And these are all the workers that I'm currently scheduling. And I can change that, which is easier for me to look at it by job. So I know that I'm scheduling my registered nurses or my nurse practitioners, and I can manage the schedule that way. One of the areas that is really helpful is to look at the variance in day-by-day schedule. So I can see that I have a 12-hour shift variance here that I need to take care of. So very easily, I can select this shift and I can look for available talent to fill that particular shift. So if I drill down, I see that Lewis and Laura are available to take this shift. And the system does all the work. So we have all the rules behind the scenes, so we know that they have the right certifications for this particular shift. And they're both available. They haven't worked back to back or any of the other policies that we have in place. So I'm going to select Laura for this shift, and I'm going to go ahead and assign her. So now, in a matter of a couple minute, I've just leveled that schedule, and I don't have a variance here anymore, and I can just repeat that for the other shifts that I have open, and boom, my next 6-week schedule, at least for today, is perfect. So I'm going to go ahead and close that out. And the other aspect of scheduling is managing the absences side. So I'm going to go into absence planning, which many of our healthcare customers are unionized, and there's a lot of rules, seniority rules around who gets the first right of refusal for taking an absence, and we handle all of that rule set behind the scenes. But I can see the conflicts that I have to resolve. So I can go conflict by conflict, or I can go look at this from a timeline view. And this makes it very, very convenient for me to see where I have conflicts, and I can move this timeline view around, and I can see that Paul and Ayumi have a conflict, and I can select for this one. I am going to approve Paul to take this particular day off, or this absence, and I'm going to approve Ayume for this one. And you can see as I'm improving each one of my staff, the other is denied. So very, very convenient. I can see it from a timeline view. I can go back and forth. I can move this around to see all of my conflicts that I have in one place. So very, 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 very convenient. So from the bottom up, we're getting demand from Oracle Health, bringing it in to build our schedule, and then looking at absence planning on top of that. But I'm going to show you one more aspect that we're bringing into the mix, which is our employee experience capability all around Oracle Me. And so this area is called our Grow application. It's an internal mobility application. And what it allows Natalia to do, she's a registered nurse. It first allows her to make sure that she is up to date on all her skills and certifications that she needs to do her current job. And we share that information again with this seamless integration with Oracle Health. We share all the skills and certifications to make sure our systems are completely in sync. So you can see here that there's a recertification for life support, CPR recertification. So we make sure that Natalia has all of the certifications. She's up to date and nothing lapses. But on top of that, we can push opportunities for Natalia to add new skills by taking additional training. And so she can update her skills and take additional training. And we use our AI engine to recommend suggested learning. So if I drill down on this cardiac ICU nurse training, and I can see that if I take this course, I'll be able to get this certification. But the incentive for Natalia is if she takes this course, she's going to be eligible for some additional shifts in the ICU, so making herself more valuable to the hospital, but also available for more shifts and giving her more opportunities to work. But from a manager perspective, this helps us manage the costs better, making our current staff available for more shifts that we need within the hospital. So we can push this training, push these skills out, and give the opportunity for our team to adopt these new skills. And those are just some of the examples of the seamless integration that we have between Oracle Health and Fusion applications. And just showing where we can help drive down staffing costs for our healthcare customers. So now I'm going to hand it off to Lisa Gulker, who's the Vice President of Product Management for Oracle Health. Lisa, take it away.
Thanks, Chris. I love to see the innovations our engineering and product teams are delivering to our Fusion healthcare customers. And I'm excited to share even more about how we are addressing the clinical and operational challenges that Steve and Chris have both talked about. Hi everyone, my name is Lisa Gulker, and I'm a nurse and a product management executive at Oracle Health. I came to Oracle Health as part of the Cerner team, and I have a much bigger work family now, and our capability set has really grown. To integrate and compose a great workflow experience, reliable decision making, that's what we are doing. I'll be talking to you about Oracle's work to enable something that I've always called predictable excellence. When I was a nurse leader in a health system, that meant I could rely on the right people, process, and technology to deliver peak performance on behalf of taking care of patients in a predictably excellent way. In my role at Oracle Health, that means that the health delivery organizations that use cloud technologies from Oracle, the providers, the consumers, the payers, the nation states, can also perform in this way and at scale. You see highlighted here that application integration is how we intend to help deliver that predictable excellence. So let's talk about how we are taking some of the capabilities that we already had in these product portfolios, unleashing them with your needs in mind to create an even more value for our healthcare customers. I work in a portfolio called Real-Time Health System. Often when I introduce that name, I get this reaction: what is a real-time health system and how do I become one? Here's how we think about real-time health system at Oracle Health. A real-time health system is a health delivery organization that uses near real-time data from many sources to improve clinical, operational, and financial efficiency and effectiveness through agile decision-making. The result is improved patient access, a better experience for the care team, and improved coordination between the frontline and the back office or business teams. In that real-time health system ecosystem, the work of the frontline care teams is supported and enhanced by, for example, virtual care technologies. We are connecting the entire ecosystem together so that the care teams have extraordinary situational awareness. This is the real-time health system portfolio. You'll see we've got operations, we've got clinical communications and collaboration, mobility solutions, smart hospital, all underpinned by great device connectivity. For those of you who are current customers, you'll recognize these as CareAware products. These are the foundational components of a real-time health system. They're secure, they're intelligent, and again, supported by the Internet of Things. Let's take a look at some of these real-time health system products. This is the Oracle Health Command Center dashboard. You'll see that it provides real-time situational awareness with streaming data that comes from multiple sources. This is a different way for healthcare systems to perform and to make decisions. We're used to working off of spreadsheets, off of written reports, but instead we're presenting the data in a format that allows you to understand what's going on at any time you need to. This is a view of the dashboard that you can use to run your leadership huddles. Think to yourself, what would it be like if I understood at any moment how well are we doing moving patients to the level of care that's been prescribed for them? How are the teams doing? What's their reality and something I call ground truth? Everything we do is about getting patients and care teams together. And so having this kind of situational awareness with not only real-time data, but predictions of what's going to be probably true in the next 8, 12, or even 24 hours ahead is really important for great decision making. That's what we see health systems today using these dashboards for. We know health system leaders don't spend their day in front of a dashboard. They are working with the frontline staff and the back office teams and business office teams, and we need to support that kind of agility. So what we've done is we've taken the power of the Oracle Health Command Center dashboard and Oracle Health Messenger and put them together in that leadership experience. Leaders can customize their Command Center experience through subscriptions to alerts that they care about using the secure experience found in Oracle Health Messenger. That alerting capability will allow them to go to the larger dashboard when they need to in real time. I'd like to talk to you about Oracle Health Workload Management. Some of you may know this as Clairvia. Oracle Health Workload Management aggregates data that is patient-centric and care team-centric. As we send this workload data to Oracle Fusion, we're providing unparalleled enterprise insight into what I like to call ground truth. That way, we can enhance predictive staffing, support length of stay optimization, and fair and equitable assignments. These are all really important components of recruiting and retaining your frontline care teams every day. With Oracle Health Workload Management, we take a patient-centric approach to gathering data and delivering that in an important way. We take into account the actual needs of the patients, individualized for them, and look at the staff that you have scheduled to make sure the needs are being met. Providing a rolling 36-hour view of anticipated staffing needs to compare against the staff that are actually scheduled allows you as a health system leader to be much more proactive in how you look at your staffing as opposed to reactive. By monitoring patients' acuity progression, you're able to make sure patients are in their appropriate venue of care. You don't want to keep low acuity patients in high cost units. You want to be able to match the skill set of your staff with the needs of your patients. This also all comes together by providing fair and equitable patient assignments. We're pushing this kind of data to the charge nurses on the front line so they can also make great decisions. Since we're able to capture discrete workload requirements of each patient, this can be part of that equitable distribution. It's also the data set that applications like Fusion HCM really need in order to be effective for your leaders. Rather than the traditional method of assuming all caregivers are the same, that all patients are the same, that we're working in strict ratios, Oracle Health Acuity Management lets you be a much more agile leader. Since we are able to capture the discrete workload requirements of each patient, this can be distributed equitably across all members of the care team. Our workload methodology is objective, valid, and reliable. We harvest data from nursing documentation that's already present in the EHR. Valid means evidence-based. We use nursing outcomes classification that gives a holistic view of the nurse's work, not a list of tasks. And it's reliable. Our algorithms run automatically to calculate acuity in the same way between nurses and across time. So we just reviewed some of the real-time health system offerings, existing capabilities that enable comprehensive throughput management, secure communications, and insights into the demand for care in near real time. As we continue to move the Oracle Health applications like the RTHS portfolio into OCI, we are joining the Fusion Cloud applications so we can better integrate our workflows. That means existing capabilities as well as future innovations will continue to create a holistic experience. This is our vision. Intelligent applications built on a combined clinical, workforce, and operational system. The Oracle Clinically Integrated ERP is the most powerful tool healthcare organizations have to accelerate their clinical and operational success. I started by introducing myself as a nurse, and we're going to keep going with that theme. We have a deep understanding of the clinical users of our systems. That knowledge drives our engineering and product teams to design with the clinicians in mind. As you've heard, we continue to advance our clinical operations products to help you drive efficiency as you care for your patients. We know that our approach to decrease the friction and administrative burden will allow care teams and the business teams to do their very best work. Now, moving on. I'm happy to be joined by Sally Deitch. Sally is an executive vice president with Ascension, and she has responsibilities for nursing and operations with Ascension. Sally, welcome. Thank you for joining us today.
Hey, Lisa. Good to see you.
Sally, can you tell us a little bit about Ascension?
Oh, sure. Well, Ascension is a ministry of the Catholic Church. We are a very large healthcare system, so about 28 billion in revenue. We operate over, around 140-ish hospitals across the United States. And so primarily based, I would say kind of Midwest up through from Texas all the way up to Michigan, but then as far reaching as Florida and Tennessee and Alabama.
Thanks for that description, Sally. That's an enormous size and complexity. Can you tell us a little bit about how Ascension is thinking about the work of the frontline care teams, their use of clinical systems, and how that connects to what we do with our back office or business teams as they support their work?
It's a great question and a great point. I think, we're not only taking this and saying, what does the future look like? But there was a very deliberate decision made to really look at our ERP as being what is going to serve not only our ministries, but what is going to serve us from the clinical side through how do we actually retain and attract talent into our organization, to how are we scheduling and paying people, to how are we providing supplies when they need them, to then how do we end up paying people, right? And so it really is an end-to-end process, but the beauty to us of Oracle is really it's the EHR component and tie-in as well. How does that innovation that's happening in the clinical record, how we're actually caring for people tie to just those fundamental systems you would say, oh, well, those have to exist in order for you to do business. So I think that's been the real tie out for us.
In your opening, Sally, you talked about your workforce, and it's all over the media. We live it every day as nurse leaders, the idea that it's really difficult to recruit and retain a workforce. They've been through a lot. Can you tell me a little bit about how Ascension is experiencing the changes that's happened over the last 3 years or so?
Right. It was. I mean, it was a really hard time. I think, the pandemic not only polarized a lot of the nation, but we saw the impact to all of our providers.
Yeah.
And that thought of, I've got to come today to care for patients, and and in some cases, the person that will be holding this person's hand when they're taking their last breath and not their family.
Mm-hmm.
And so to move from that to now saying, where are the challenges, and how do you actually look at retention and what's important to our staff? I think we've all had to take a step back and say, we can't ever go back to how it was before. We've got to say, what is it looking like moving forward? And I think there's also the generational piece that we have to take into account. And I am a mother of 5 children, and my 5 boys. My husband and I kind of laugh, and then talking with my colleagues, when we talk about our kids and their ability to suffer, it is very different. It's very different. It's kind of night and day. And so uh, I was talking to a colleague who you all know, Eduardo Conrado, and he was talking about one of his daughters, and he said that their tolerance for things in the workforce that don't work is very low.
Mm.
And, so, not saying that old nurses, we did it a certain way, but you just worked around it, you figured it out. And to now say that could actually be a barrier to retention.
Yeah.
If the processes aren't working, if the equipment's not functioning, if the technology is impeding their ability to care for patients, their tolerance level with that may be very minimal. And so we have to figure out, that's to me the imperative. We have to figure out, how do we change that paradigm? How do we address those issues so that it isn't the reason why we're losing nurses within the workforce, that instead we're creating an environment that enables them to care for patients top of their license,
Yeah.
without having any barrier whatsoever.
Yeah, Sally, I love what you just said about the differences in the workforce, because it is very different. What I am seeing is the newer generation of nurses and clinicians of all sorts, not just nurses, really expect to have the same kind of seamless experience with technology that they have in the rest of their life. And when they spend so much time at work and at the bedside, they really appreciate if we can start to infuse some of that same experience into how they're using technology. How are you thinking specifically about the way nurses need to experience differences in the way they use technology for care?
I think we have to be careful as we innovate, which is one of, a value that we truly say innovation and creativity is absolutely what we need to do, that we do it responsibly, and that we're approaching it saying, how does this actually benefit the caregiver in their direct tie to the patient? And so don't ever want to be, let's go throw everything we can at the wall, without there really being validation that this is truly something that can impact the caregiver, and that actual interaction relationship with the patient. So, I think we need to take it one step at a time, and I think that's where the partnership with Oracle, with the developers, becomes key, because I think too many times we're seeing healthcare trying to do it on its own, and we can't do that without having really a seamless integration with the technology developers.
Sally, some of what we've shown today has been about the predictive capabilities, the analytics that we have in some of our clinical systems, as well as in the business systems. Now we have an opportunity to bring them together. Can you talk a little bit about how you see Ascension using these kinds of predictive capabilities in their day-to-day leadership practices and the way they make decisions? How are you thinking about that?
Let's kind of first base on Oracle Fusion. And when we've looked at our current workflows, and I'm going to tie this back to retention of our staff.
Mm-hmm.
So when you look at just the workload of a leadership team, of that manager who's actually managing employees, and you say, okay, where's your time being spent? And we've gone through this of where is their time being spent? Their time literally just gets sucked away by, I've got to go work on this, and then I've got to get this done, and so it's not about spending time with the associates. It's not about creating that connection and tying to our mission and building that culture. It's spent on, for lack of a better term, paperwork, and maybe not necessarily on paper,
Sure.
but but how, as we looked at it, how do you take, again, if I look at Oracle Fusion, how do you create the ability for the manager, for that people leader, to do their job efficiently, effectively, and quickly, so that it actually gives them time to spend with the employee? So we're looking at it not only from that standpoint, but then what are the analytics pieces that come from there? And how do you look at turnover data that is more real time, um, that is not only like kind of in your face, but that can break it down into, is it a specific shift? Is it a specific type of person? I mean, what is it that we're losing and why? So I think which then feeds back in through HCM, if I kind of go in my head, then how does that fit into position control, and what am I recruiting for? So where is talent acquisition involved? Where is the employee experience? How does that look? I mean, and even in looking at Fusion, the ability to say, when do I prompt employees? So I hire somebody, so can I prompt them in 30 days? Make sure you've enrolled in your health insurance. Make sure you've done these things, right? So it's not just about, a lot of times, it's not just about, boy, I can come in and clinically work and know what my job is as a nurse in the OR. There's also that people part of, they are associates within our organization, and again, value-based, a value-based organization that says reverence for us, respect and compassion for the dignity and diversity of every life that not only we take care of, but we feel the same responsibility and reverence that we should have for our employees. So all of these pieces, you go, okay, but where are all the barriers that are happening along this realm? And that's the data point we need to get to. So if you look at the way that HCM ties theoretically through UKG, say UKG Kronos or UKG Workforce, that ties into supply chain, that ties to finance, all of those pieces are actually so integrated. You can't just fix one without impacting the rest. And you have to understand the intricacies of how those all align. And so I think, I will say, I think as a clinician, not only I always take it of, well, it's the way a clinician's mind works. It's kind of the way we did a patho flow sheet way back when, of saying, how does this affect all these other systems? It's the same process in dissecting how the HCM affects, if I say an employee or a manager or my CFO, I can take the same journey and dissect it down that way as well.
Thank you, Sally. Thank you so, so much for all of the time you've spent with me today. I feel inspired. I'm inspired by the work we're doing together and the vision you just set out for Oracle and Ascension together. And I am confident with your partnership, we're going to be able to do beautiful and amazing work. So thank you so much. Thank you.
Okay. It was great. Thank you.
I hope that conversation with Sally inspired all of you the way it did me. With that, I'll turn it back to Steve.
Thank you, Lisa and Chris, for your updates and demonstrations today. It's always great to hear from customers and always great to see the innovation in real time. And a special thank you to Sally for taking your time out of your normal day to join us on the webcast and share Ascension's experience. And also thank you to all of our customers, because as I said earlier in the presentation, all this innovation comes as part of our collaboration and partnership with feedback from you, our customers and partners. Now, before I wrap today, I also wanted to let you know you can continue sending questions and feedback through the Q&A feature as long as it remains open, and we'll do our very best to respond to all of you real time or afterwards. As I mentioned at the top of the webcast, I'm very excited where we are and where we're going through our efforts to integrate Fusion applications for our business operations and healthcare clinical applications. Obviously, healthcare is critically important to all of us, and I can tell you our entire team here at Oracle is truly energized to make a difference on behalf of the community and you, our customers and our partners. On behalf of our guests today and everyone at Oracle, thank you for joining another edition of Inside Access. We look forward to seeing you at our next episode at 11 a.m. Central on March 26th. Have a great rest of your day.